Dr. Amy Flanagan from the Healthy Back, and we're talking today about soft tissue mobilization, just explaining on what it is and why people need it. So basically, when I say soft tissue, that means not just muscles, but also ligaments, tendons, fat tissue, your lymph, your blood vessels. Pretty much everything that holds our bones together is our connective tissue. And a lot of people injure this area and also just overuse this area. So what happens to this area, adhesions and collagen link fibers begin to attach to each other, causing decreased range of motion, causing decreased blood circulation, and that can cause the pain and the dull aches, and it can also cause just your body not functioning correctly from top to bottom just because that connective tissue is adhesed or not moving correctly. So there's a lot of different ways we can get that mobilization back into that tissue. We do a lot of different things, and this kind of shows you my first technique that I have done and that I've gone through the advanced is the Graston technique. These are the Graston instruments. They are great, they are fabulous, they help get that circulation into those adhesions, breaking it up. They do not have a lot of they don't want you to have a lot of petechiae that comes up because that can cause some soreness. So that's a technique that's a little less invasive for people if they're worried about some of the bruising. These are my Graston tools, and now that's more invasive where we're really trying to break up the petechiae and almost bleed the muscle in that tissue to help bring that circulation to help heal the tissue from the inside out. And then these are two tools that I actually had a patient make for me because they're kind of a combination of the Graston instruments and the gua sha tools, and they really are able, kind of that in between where they're bringing up petechiae, but maybe not so much as the gua sha tools, and a little more than the Graston instruments. So that's kind of the in between, but basically we're getting that circulation into that tissue to help break adhesions and bring circulation to help heal that tissue from the inside out. Along with that type of technique, we also use the cupping. And the cupping, same thing. We're bringing the circulation from the inside out into that tissue to help heal the tissue. You can get a lot of bruising from that, and you can be very sore from any type of soft tissue mobilization technique. But after that soreness, your tissue is really healing, you feel a lot better, and you have that range of motion back. So along with the tools and instruments here, we have the shockwave system as well. And this is, it's well researched that it actually helps with tissue healing as well. The research shows an actual ligament injured and it's unorganized and it looks torn. This actually research doing shockwave makes that tissue become more organized and less tear into that tissue. So that's why I added that to the treatment plan, just because it really has high research on tissue healing. All these techniques as well, very science-based, a lot of research, a lot of proof that it does what it's supposed to do. And that's why we do those techniques here at the Healthy Back.